Welcome to the Memora Healthcare Delivery Podcast. Through conversations with industry leaders and innovators, we uncover ways to simplify how patients and care teams navigate complex care delivery.
Hi, everyone. This is Jamie Colbert, Chief Medical Officer for Memora Health and host of the Care Delivery Podcast. I'm joined today by Haley Bolton, Corporate Director of Patient Access Support Services at Emory Healthcare.
Hey, Jamie. Thank you so much for having me today.
Thanks so much for being here, Haley. Can we start by you just telling us a little bit about yourself and the work that you do at Emory?
I'm a corporate director at Emory Healthcare. I've been there now a little bit over 10 years. And in my role, I support our patient access support services. That entails a pretty wide range of functions, including our scheduling infrastructure, so our provider templates, visit types, the intake questions that we ask our patients to navigate them to the right provider and appointment and location. I also have oversight for our software solutions, our analytics, and our quality assurance and training programs.
Great. Tell us a little bit about your background. How did you end up in the space that you are in today? What was your journey?
Yeah, my journey into healthcare was deeply personal, like so many of my colleagues. Growing up, I watched my dad courageously battle multiple sclerosis. He was in and out of the healthcare system between his MS-related appointments. He also had 3 heart attacks, a stroke, and several hospitalizations. I was his caregiver from a really young age, and in that role witnessed firsthand the intense challenges that our patients and families face when they're navigating the healthcare system. Coordinating care, deciphering complex medical information, trying to figure out the treatments that their loved ones need. It was a really overwhelming process for a family at times, and I knew that I wanted to be a part of the solution. And that experience really shaped my decision to pursue a career in healthcare. I didn't enjoy chemistry and biology, and so I knew I wasn't going to be a physician or a nurse practitioner, but I wanted to be a part of the healthcare system, really driving innovative solutions that put the patient at the center, solutions that could make it easier for patients to get the care that they needed and to reduce some of the pain points and inefficiencies. So every day I'm really inspired to come to work and help transform the healthcare landscape and create a more navigable system, because I know how hard it can be and I know the difference that it can make to have a system that has improved access, that has enhanced transparency, and that really puts a human connection within healthcare. And those are the driving forces behind the work that I'm doing.
That's amazing. So many people that I've encountered who work in the healthcare space are motivated by personal experiences, whether it's their own family, whether it's friends or colleagues that they've worked with. We know that healthcare really touches all of us, and really inspiring to see kind of how you have taken that personal experience and applied it to your own work. Tell us, in your experience, what do you see as some of the biggest challenges that patients face in getting the care that they need? Why is that not always happening? What are some of the barriers that are facing our patients today?
Yeah, I think that access to care can be, very challenging in that it's not always seamless and intuitive. The scheduling process in particular can be very frustrating. You're navigating complex phone trees. You might be waiting on hold while the team member you're talking to is trying to connect with a nurse or an in-clinic team member, and you're piecing together sometimes fragmented availability across different providers and locations. And so really, I think as we think of how do we make our access more patient-centric, more consumer-focused, it's, how do we empower patients to manage their own care on their own time? How do we reduce friction and improve access? And one of the ways that I'm excited to be pushing this work forward is implementing self-scheduling and increasing greater transparency around costs, insurance coverage, and trying to shift patients out of the role of playing detective, where they're trying to decipher medical bills and negotiate with their payer, and providing clear and more upfront information to make more informed decisions about their care. I would say as we head into the future around how do we make it an easier experience as a consumer, I think you're really focusing on a personal, compassionate, guided experience based on different journeys we'd expect our patients to take, recognizing that they're unique individuals with unique needs, really focusing and committing to a more human-centered approach. We're putting empathy and communication and cultural competence at the forefront of everything we're doing. I think it's that integration of technology in a profound way to automate administrative tasks off of our team that free them up to have more time to be fresh on the phone, to be empathetic, to be caring, and to be empowered through the tool that they're using to meet the patient's needs and preferences. I think it's really that you're striking the right balance between high tech and high touch and using innovative solutions to enhance our access while, again, preserving that personal connection that's so vital to care.
Yeah, that's really interesting to unpack there because on one hand, patients want that personal connection, right? They want to feel that they're being seen as an individual and that they're able to connect with a real person, right? On the clinical side, whether that's a nurse, whether that's somebody who's working on behalf of the clinical team. But on the other hand, you also mentioned technology and how, there are ways that we can leverage technology to enhance that experience that patients are having. So how do we kind of balance that tension there between the desire for patients to have more of a personal connection to their healthcare journey and the use of technology to perhaps enable that?
I think there are some solutions that help us with accomplishing that goal with a CRM that helps you build out a profile for Haley and recognize how long she's been a patient, more of her background, where she lives, what's in close proximity to her. I think the incorporation of some of our social determinant health information and factors, again, building out more of the profile of who I am, what I hope to hear from you. And again, recognizing that my preferences around text, my preference around my church communication might look very different from my mom's or from my neighbors or from my husband's. And as we build out within our current efforts to modernize our contact center, considering what's appropriate for building out a call deflection model that will get Joan to the right room number because she's trying to check on her husband and talk to him. She doesn't need to talk to an operator, potentially, right, to have her call routed to the right room, but then freeing up our staff to have longer interactions with the right patients who really need to talk to somebody. Our goal is that it's not a cumbersome and lengthy phone tree, that the IVR isn't clunky. And I think we've really leveraged and relied on hearing from our patients more about how they would hope their experience would be. I think the voice of the patient becomes so important here, but recognizing again that patients look very different because we are unique people with unique needs and unique preferences, and trying to solve for different pathways for different patient scenarios, I think becomes really, really critical here. But again, I think leveraging technology for where it's a really obvious example of a patient could be self-served through a message or through a deflection pathway.
When you say self-serve, tell us more about what that could look like, right? So instead of them speaking to a call center representative, how might that patient be managed through technology?
Yeah, I think that would be our hope if Sonia has a sore throat, that she can go on to an application and begin to input some of her symptoms and actually go through a series of questions that a nurse might ask her to understand where's the right landing point for you. Is it primary care? Is it urgent care? Is it a virtual ER? Figuring out how do we take some of the framework that exists for our nursing staff or for our non-clinical schedulers and shift that into a format where patients can navigate on their own time frame in a means that might be convenient or more comfortable for them. And so some of the work that we are focused on when we talk about self-service is an automated wait list. How do we move patients up more quickly without having somebody call, try to reach the patient, get a hold of them, or maybe reach their voicemail, but just have that moving in the background to alert them as soon as the appointment becomes available. Some of it is building out intake questions to get you to the right provider that you can answer yourself as a patient. But I think that next space for where we're hoping to focus is more around how do we triage acuity, how do we triage the patient's symptoms also and get them to the right spot. So lots of use cases for self-service.
Yeah. So thinking about technology there, do you see a role for AI? I know there's a lot of interest right now in AI applications in healthcare, but as you talk through this example with a patient having symptoms, trying to get that patient the right level of care or directed or triaged to the appropriate resource, could AI help in that instance?
Yeah, I'm really excited about where we can head with And when I hope about where we are in a couple of years as a healthcare landscape, I would hope that we have AI along the way, to your point, informing AI reading a pathology report or an imaging report and actually doing some of that disease detection or understanding a referral order, and then helping make informed recommendations around when Haley needs to be seen, who she needs to be seen by, to decrease that kind of administrative time to review records, to gather records, to figure out the right provider or the right appointment. Having AI involved in triage, acuity-based scheduling, I think would be a huge win in decreasing some of that wait time to be seen and wait time to get in front of potentially a nurse navigator and to be reviewed.
Got it. And as we think about that patient who is looking for help, based on kind of your assessment of the patient population you're serving, do you have a sense of what percentage of patient needs could be handled without a live human conversation? Right? Could be handled either through, if there's some sort of automated chat function or IVR or something else, such that perhaps the call center and the nurses can be focused on those patients who are perhaps having more acute issues, right? That couldn't be handled in as much of an automated way.
Yeah, I think as we review our telephony data, I think we see there are about 10% of our calls that are, I think, the lower hanging fruit, where it's a patient wanting help with directions or navigation that could be solved through an application, right? A wayfinding application or through a different tool. And then we have about half of our remaining calls are scheduling related. And a large portion of those potentially could be the patient empowered to move through their own series of questions, whether it's ticket scheduling or more of a direct scheduling option to figure out the right provider. And then the rest, to your point, is freeing up our clinical teams to focus on what they do best, delivering personalized, compassionate care, really helping them deal with the more acute escalations, the more complicated patient triage, and then freeing up our staff for more of the scheduling interactions that are cross service lines, more complex to coordinate, that would require our teams to be more heavily involved.
Got it. As you think about some of these technology solutions that are out there that could help with some of the self-service and automation, are there ones that particularly stand out for you that you're excited about either partnering with or just learning more about their capabilities?
Yeah, we've got an RFP out right now and are exploring actively partners for wayfinding. You're really excited about moving into that space. There are players in there like Gozio, and we are currently undergoing a modernization of our contact center, really shifting into a space where we're leveraging AI for quality auditing and monitoring and compliance of our calls with different regulatory requirements, making sure that we feel comfortable with the customer service experience that our patients have. And then really, heavily focused on leveraging all of Epic's functionality. Epic is our electronic medical record, really leaning into the functionality that they have around self-service and how we use this to drive patients through personalize and optimize workflow to get them to the right provider.
Got it. Does that typically work through the Epic MyChart application?
Yeah. So we've been live on Epic for a little bit over a year and a half now. And since going live, really have been focused on building out our inventory of appointments that are available for patients to self-serve into, and then building out pathways that remove and reduce the number of questions. And it's a very simple, patient-friendly scheduling experience. Our goal is to make the questions simple enough that we account for patients' health literacy and that the questions are really only those that are pertinent and medically necessary.
Got it. And around that topic of health literacy, I know that there's so much focus right now on health equity, really understanding the social determinants of health that play such a large role in not only patients accessing care, but the outcomes of care that they achieve. How are you thinking about collecting social determinant of health information, engaging with patients in ways that are ensuring you're closing some of the SDOH barriers that may exist? Are there particular programs that you have implemented to address some of these SDOH barriers or to collect more data on your patients?
Yeah, it's a great question, and one that we've been really hyper focused on as we've begun this self-service journey. We have wanted to make sure that we aren't leaving patients behind. Access at Emory reports up through the Office of Transformation. And within our transformation office, we also have teams that are focused on health equity and the patient experience and provider well-being. And so that connection of these teams under that shared transformation umbrella, I think, has led to a lot of overlapping initiatives and work, specifically around social determinants of health. There's been a lot of data tracking around our patients, understanding who is leveraging MyChart, self-scheduling, or what kind of outcomes we're seeing, how we are tracking our patients throughout our system. And to your point, a lot of focus on being mindful of our patients' expectations and building out pathways that are friendly to them, that allow them to be reached. I think the next phase of a lot of our online scheduling work is how do we translate this into different languages? How do we put this self-service pathway in front of all of our patients so that it's accessible to them? But we've amassed a ton of data and again are trying to leverage this information so that we are truly driving informed decision-making around how we make access stronger and reach our patients and understand their needs.
Makes a ton of sense. I've heard a lot about the so-called digital divide, where we see certain populations that tend to be lower socioeconomic status who may not be as digitally connected, may not have as much access to broadband internet or Wi-Fi. I'm curious, from your own work, have you seen any of these barriers at play in terms of the rates at which patients from different groups are accessing care or are able to use some of these features within MyChart, for example?
We have seen that play out in terms of our arrival rates. I will say from my own experience, this has been a topic that I have been tracking and actively engaged with our operational teams on over the past decade. We know that some of our patients who lack transportation and potentially lack a cell phone where the number that they are giving when they call in is changing almost with every single scheduling transaction. We find that they are arriving at lower rates and that then they are presenting in our ER or being admitted to our hospital, and they're not being seen in the outpatient setting that would have been more appropriate for them. And so there's a lot of effort that we've put into trying to better understand and predict some of these no-shows and late cancellations, and then find a way to empower our teams to see these patients as potentially being a high risk for failure to arrive and reach out more proactively to help arrange transportation to the clinic or to offer to convert the visit into telemedicine. But to your point, Jamie, often these patients don't have reliable broadband or a means to connect over telemedicine visit. So it has been a lot of discussion with our team of how do we get into the community? How do we reach our patients where they are? And a lot of that has been empowering our social workers and our nurses and our providers to better understand some of the patients who might be at a higher risk of failing to arrive and at a higher risk of decompensating so they can target them in a very meaningful way. And then a lot of the work we're focused on now that we have a health equity officer is focused more around how do we partner with different community organizers and different community resources. And you think of ways, again, to show up for our patients where they need to be seen or how they might be best prepared to receive care.
Got it. A lot of what you just spoke to obviously relies on data and being able to measure what are some of the rates you're seeing for patients coming in, patients no-showing, patients using some of the tools available to them through the EMR, through the patient portal. Anything you can share with our listeners in terms of how your team leverages data? Have you made any investments in data or analytics in order to support some of these efforts?
Yes, there's been tremendous investment across our organization. Most specifically, we've hired a chief data and analytics officer who joined our team less than a year ago. And with his recent addition to our leadership team, there has been a very thoughtful rollout of director level roles focused on AI and machine learning around data strategy, data visualization. And I'm really excited and inspired by the direction our organization is headed in. I mentioned earlier, I think we are poised right now to leverage the huge wealth of information that we have from patient records and treatment outcomes to operational metrics and consumer behavior. I think where we sit as an organization is be ready to transform that data into actionable insights to drive informed decision making. I think we're going to be leveraging more predictive modeling around sepsis and fall risk and things like that, and leveraging AI and advanced visualization tools to uncover some of these patterns and create more personalized, proactive care models. I think data will be a key differentiator for our healthcare system in the years to come, and the way that we're trying to use data to seamlessly integrate with technology and with operations.
That brings us to the end of our time today. Really appreciate you coming on our podcast today, Haley, and sharing with our listeners your perspective from the work that you and your team are doing at Emory. Until next time, everyone, this is Jamie Colbert.
Thanks for listening to the Memora Healthcare Delivery Podcast. For more ideas on simplifying complex care for care teams and patients, visit memorahealth.com.